This is Nick here with Archangel and Tristan LaBelle. We are doing a Medicare 101 presentation. We're going to do, first presentation is going to be for a Medicare Advantage client. So we're going to go through the entire presentation, and then you are going to, after this video, watch a Care Compare training video to see which plan is going to be best and how to enroll the client. So first off, thank you, Tristan, for joining me today. I appreciate you taking the time to sit down to go over your Medicare options with me. I'm going to do a few things here today. First off, I'm going to tell you about myself a little bit, about the company, Archangel Brokers, who we represent, and the plans that I can help you enroll with. Then I'm going to ask you a few questions to get to know you, because everybody's situation is completely different. So it's not a cookie cutter type of a program here. I'm going to explain Medicare, how it works, Parts A, Parts B, Part C, Part D. A lot of people are confused with what you need and what the plans cover, so I'm going to go over all that with you. Then we're going to enroll you in a plan, so your Medicare can take effect in September when you're turning 65. And then lastly, we're going to wrap up, answer any final questions. Then I'm going to also ask you who you know that I can help. Fair enough?
Sounds great to me.
Awesome. So first off, Archangel Brokers, we've been around since 2021. We were founded by 3 tenured insurance agents. And we help people not only with Medicare, right? We help people with Medicare Advantage, with Medicare supplemental programs, with life insurance, with retirement plans, with critical illness, and also with long-term care, which could be the biggest cost to some folks. So here's a picture of my license by the Florida Department of Financial Services. I've been licensed since 2015. I've been in the business. I know what I'm doing. And I'm definitely the guy to be able to take care of you today. Next, our Medicare partners, as you can see here, some of these logos probably look familiar to you. Humanicare Plus, United, AARP, Blue Cross of Medicare, Mutual of Omaha, WellCare. Any of those names ring a bell?
Yeah, of course. They're common household names.
Absolutely. And then next off, like I said, I know I'm not here to sell you life insurance today, but we do offer final expense, whole life insurance programs, term life insurance for you, for the family, for kids, also for grandkids if it's necessary. And we have products from Americo, Mutual of Omaha, AIG, Foresters, Mutual of Omaha, Transamerica, more household names, right?
Absolutely. You see all those advertisements everywhere.
Right. Commercials, buses, vans, they're everywhere. We're everywhere, right? And the good thing about working with a broker with Archangel is that I represent all these plans, right? There are a lot of folks who are captive agents, who are agents who just work for Humana, who just work for Care Plus, who just work for these companies, and they're going to tell you what that company does and how they can help you, but they're not able to help you with all the different plans. So for me, it does not matter whether you choose Aetna or WellCare. My concern is making sure that the plan fits you, not fits me. Makes sense, right?
Yeah, you're basically working for me.
Right, for free. Right, there's no charge for this, so that's good. You know, a lot of people ask me, how much does this cost? Right, it doesn't cost anything. I'm going to enroll you in the plan. Whatever plan I enroll you in, the company's going to pay me. You don't have to worry about anything.
Even better.
Right? Pretty good. Free is the best price. So that's about the company. A little bit about me. I've been in the business, like I said, since 2015. I grew up in Idaho. I was a rescue swimmer in the Navy. I worked in retail for 10 years. I've been doing insurance, like I said, since 2015. So were you a veteran by chance?
I am.
Awesome. Thank you for your service.
Thank you for your service.
Absolutely. My pleasure. So, you know a little bit about myself, a little bit about the company, who we represent. Now it's time to get to know you. Like I said, everything is not a cookie cutter program here. We're going to make sure that we find a plan that's going to fit your needs. So first off, your full legal name.
Tristan LaBelle.
All right. Perfect. Like Patty?
It's like Patty.
Perfect.
No relations, though.
Oh, darn. And your date of birth.
07/16/1957.
All right. You're looking good. What's the secret?
Carrots. A lot of carrots.
That's unfortunate. I was hoping to be something else. Your address, I'm at your house today here. I got here. I drove here. I parked here. So I got that in my system. Your phone number, I have that. I called you on your phone number. So we're good there. Tell me a little about your current insurance. You have insurance? You have employer insurance? What's your situation right now?
Yeah, right now I work for the school board and I have Cigna. I think I pay like $50 a paycheck. I believe it could be a little bit more. I know I have like dental on there. I'm paying, I believe, $20 a month. Vision benefits, I think they're about $13 per month. And then medications, I mean, I think I pay like maybe $50 a month for medications.
So let's say you paid every 2 weeks?
That's per month. I was kind of doing both.
Per month. So you're
Yep.
at like 120, 135 a month, give or take.
Yeah, somewhere around there. Maybe a little bit more.
Okay, perfect. And your current primary physician, are you married to him or her?
Not really. I'd like to keep them, but I'm not.
Okay. A lot of people are married to their doctors. You know, doctors change plans, they retire, they move, right? So the doctor really isn't the most important part. The plan is the most important part because that's going to be your pocket. Your current copays, your deductibles. What's your deductible every year? Usually it's like 5,000.
I'm not really sure, but maybe we could pull out the paperwork and we could look at it.
Okay. Yep. We can. It's not zero. I know that.
Yeah.
You don't give me any of those zeros.
No.
And one of the most important parts, obviously, is your medications. Are you taking any medications to help you stay so healthy?
I am. I'm taking lisinopril.
Mm-hmm.
I believe 5 milligrams.
Not too bad.
I'm taking metformin. I believe 500 milligrams a day.
Is that the classic or the extended release? Should say HCl or ER on the bottle.
I'm not really sure. Should we grab the bottles?
Yes, you should.
Okay. Looks like it's an extended release.
Looks like it's ER. See, that's a very important. You know, a lot of metformin has about 35 different variations of metformin. One costs 1 cent for 30 pills. One costs $400 for a pill.
Wow.
So that's kind of good to know. So lisinopril, metformin. What else you got?
I believe that's it.
Okay, perfect. Pretty healthy here. And did you, by chance, you're turning 65 in September, did you have your Medicare card yet? It should have came in an envelope from Medicare, red, white, and blue card on the inside.
Yeah, I believe I do. Is this it?
That's it. Perfect.
All right.
Ready to rock and roll. And before we get into Medicare, do you have any life insurance right now or anything that acts like life insurance?
Acts like life insurance. What do you mean?
So you're a teacher, obviously, you work for the school board. That would be a 403B. So teachers typically have a 403B retirement plan, or you enrolled in the pension plan. That's when you first started being a teacher 40 years ago. Do you remember which box you checked?
I don't know. I have the drop.
You have the drop. Okay, so you have the 403B plan, the retirement plan. You don't have the pension.
Yeah, they said it's a pension and then another account. So
okay,
yeah.
Okay, so you should get paperwork at least every 3 months for that. You get a statement or something in the mail, an email. You do it online.
Yeah.
Okay. So that's a note right there. That's another thing. We help people protect their money. You worked your entire life for your money. Obviously, one of the most important things is making sure you keep that money, especially in retirement. So that's something we can address at a later date. And you have a SSA account you mentioned on the phone for Social Security. Do you recall, give or take, what your Social Security is going to be a month once you retire in September?
Yeah, I think it was like $2,300 a month.
Okay. All right. So the $2,300 a month is going to be your Social Security. One thing to keep in mind is you're not going to qualify for Medicaid, right? Medicare is your health insurance. That's the red, white, and blue card we have right here on the table. Medicaid is a gold card. That's for folks who are low income, right? You have to have less than $1,200 a month in income if you're married. So you just alone surpass that. So anytime you see a commercial on TV that says grocery card, all your money back every month, we're going to do everything for you, you don't pay a penny, that doesn't apply to you.
Okay.
You don't qualify for Medicaid.
You see a lot of advertisements for those.
Right, and they give everything away, right? You have to be less than $1,200 a month for a married couple to qualify for that. So I'm going to show you the plans today. I'm going to review the plans that best fit your needs, but just keep that in mind. Next week or next month or 2 years from now when you're watching TV and you're like, oh, that plan is better than my plan. You're probably not going to qualify for that plan because that's the only plans they advertise on TV. Make sense?
It makes sense.
Awesome. And getting into your plan, there's a few different plans. We're going to go over how all of that works. But of your health concerns, what's most important to you? The vision plan, the dental plan, keeping your doctor, or due to your good health, potentially reducing that $170 a month Part B and give you some money back into your check every month?
I'd like to have good benefits.
Okay.
I would rather like not have the cheapest, but have better.
Mm-hmm.
But obviously I don't want to spend the most.
Right. Want your cake and eat it and everything, obviously, right? Okay, beautiful. Anything I missed?
I do have life insurance through the school board. I think it's just something that they set me up with. I don't know if I'll be able to roll that over. Maybe I could ask you that, if I can roll that over and keep it.
Probably not.
Okay.
Just like your Cigna insurance, you can't keep that.
Okay.
You don't get your desk anymore. you're retiring. You got to leave it all there. Unless you want to continue working, we could probably arrange for you to do another 10 years.
No, that's
No?
okay. That's
All
okay.
right. All right, good deal. Anything else?
No, I think that's about it.
Okay, perfect. Thank you. So going over Medicare, right? Medicare can be confusing. I'm going to unconfuse you today, right? It's kind of an alphabet soup. It's by the government, so it's inherently confusing. But there's really 4 parts to Medicare, A, B, C, and D, right? Part A is your hospital coverage. It's going to cover your inpatient hospital care, skilled nursing facility, home care, and hospice care. Basically, that's the room and the board. It's like staying in a hotel. Doesn't cover much, right? That's your Part A. You worked 40 quarters, which is 10 years in the United States. You worked much more than 10 years. So all that money you paid into Social Security, when you see that deductions on your check every month, that's going to cover your Part A benefits, right? That's free to have. Part B is your medical insurance. It's going to cover services from doctors, healthcare providers, outpatient care, medical equipment, wheelchairs, casts, splints, anything the doctor does to you or advises you to do. You need a wheelchair, you need an MRI, you need a CAT scan, you need blood work. That's all going to be under your Part B. That's in the doctor's office or in a hospital. Same Part B. I'm going to skip to D because this is a government program. Part D is your drug plan. That's your lisinopril and your metformin, right? It's your prescription drug plan.
Okay, D for drugs.
E for drugs, you got it. Something makes sense here. Next is Part C, which comes last after D. Part C is Medicare A plus Medicare B plus Part D. It's called the Medicare Advantage with Prescription Drug Plan, also known as Part C. So if you hear Part C, you hear Medicare Advantage, you hear MAPD, all of those names and plans, all those means the same thing, okay?
Okay.
So first, what I'm going to do is I'm going to explain what original Medicare covers. So if I wasn't here today, you didn't want to sit down with me, and you just wanted original Medicare, you don't want to do anything, right? This is what Medicare is going to cover, what your copays, what your deductibles are, and then I'm going to explain to you how we can give those costs to the insurance companies, all right?
Okay.
All right, so Medicare Part A goes in phase periods, right? So if you're hospitalized, day 1 through 60, you're going to have a copay of $1,556. This is all 2022 numbers. So every year, the cost of everything goes up, inflation, et cetera. All these numbers increase every year. So this is for the year 2022, obviously, that we're in right now. That benefit period is 60-day window. So that's a 6 times per year you could incur that cost. You have to time it perfectly. But if you went to the hospital for 3 days on January 1st, you were discharged, you went home, you go back March 1st, right? After the 60-day window, March 1st, you're back in the hospital 3 days, another $1,556. Repeat that all year. That's a lot of money. Now, God forbid, you're in the hospital days 61 through 90. You're going to pay $389 every single day you're in the hospital. They don't keep people in the hospital that much these days. They try to get you in and get you out, so it doesn't happen that much. But if it did, $389 a day for 30 days is a few bucks, right? That's like staying at the Westin at the beach for a month. Pretty expensive. It's not.
Rather stay there.
Yeah. Days 91 through 150 or your lifetime reserve days, that's $778 per day. After that, you pay 100%, which we all know hospital bills are completely insane. That's your Part A. Also in your Part A is your skilled nursing coverage. You're going to be covered days 1 through 20, 100%. If you get in the hospital, you have a surgery, something happens, you need a skilled nursing facility afterwards for a week or 2 weeks, that's going to be covered up to 20 days, 100%. If you're approved, doctor has to approve that. You have to go to an approved facility. It's not easy to get approved for that. So that's a little bit of a headache there.
Jump into the rings of fire.
Right. Once you've completed a surgery. So you're not in the best shape to jump through rings of fire at that point, probably. And after that, days 21 through 100, you're going to pay $194.50 per day. That's like the Motel 6, right, for the next 80 days. Pretty expensive. So that's your Part A. That's your hospital, your room, your board, your skilled nursing coverage. Next off, we have our Part B. That's what you're going to pay a monthly premium for, right? So this $2,300 a month you're getting with your Social Security, they're going to start deducting September 1st or whenever you get your check, $170.10 per month. This usually does increase every year. As you've heard, we had the biggest increase of history for 2022. Huge increase, $170 from $148. They're going to deduct that from your check every month. That goes directly to Uncle Sam. Has nothing to do with me. Has nothing to do with the plan. That goes to Uncle Sam. After that, you're going to have a deductible every year of $233. After you meet that $233 deductible, Medicare is going to pay 80% of the bill. You're going to be left with 20% of the bill.
Sounds expensive.
It is. Original Medicare is very expensive. That's why insurance companies came in, especially Medicare Advantage companies. They health maintenance organization to help you manage your care, to help you stay healthy. If the company can help you stay healthy, you're going to continue to stay healthy. The company's going to make money. Everybody's going to be happy. So it's expensive. You're wondering how we can take care of these costs, correct?
Uh-huh.
So based on your income, based on your medications, based on your current situation, you're not married to your doctor, you don't have 100 problems, you're not at a specialist, once a week. I'm going to suggest a plan for you, but I'm going to give you both options, obviously. So option number one, here on the left side is Original Medicare. You're still going to have your Part A, you're still going to pay for your Part B, but you're also going to add on a drug plan, a Part D plan to cover your lisinopril, your metformin, and then we're also going to add a Medicare supplement policy on top of that. So looking at that plan, you're at $170 a month for your Part B and 10 cents. Your prescription drug plan, we can probably get you one for around $12 a month. And these Medicare supplement plans run about $250 a month. So I'm not that good at math, but that's about $400 a month for your Medicare cost. Plus, we got to add a dental, we got to add a hearing plan right there. So probably $225, $250, $275 a month. Quite a bit of money. Option two is a Medicare Advantage. A plus B plus D equals C. You're going to still have your Part A. You're going to still pay for your Part B, but they're going to give you extra benefits. They're going to give you dental. They're going to give you vision. They're going to give you hearing. They're going to give you prescription drug plan. They're going to give you silver sneakers for the gym. They're going to give you an over-the-counter card every month to help you cover your costs for vitamins, for Band-Aids, for whenever you go to Walgreens, you see the sticker with the price that says OTC on it.
Mm-hmm.
Anything that says OTC on it, you can buy. These companies are going to give you free money every month, so you can purchase those.
Okay, cool.
Based on those two options, the Medicare supplement for the $275 a month or the Part C Medicare Advantage, what do you think best fits your needs or you're most comfortable with?
Part C sounds pretty good.
Yeah.
Hard to beat.
No, you can't beat it, right? And especially in Miami-Dade County, we have a lot of seniors here. We have a lot of retirees. We have the second or third largest school district in the entire nation. I believe it's the second. The first is L.A. So we have a ton of teachers here. We have a huge government population of workers here. So the Medicare Advantage plans really do fit down here. So there are four main Medicare Advantage options that you have. One, I'm going to cross off the table right now because that is a Medicaid, HMO, or PPO. That, like I said, means less than $1,200 a month. You can't qualify for that. Your next three options are a flagship. They call them HMO. It's like the best plan the company offers. They have the lowest co-pays for your doctor, for your specialist, all that stuff. You pay really very little out of pocket. Those are for folks that do have maybe some health concerns, though, that do see a doctor or specialist pretty often. The next plan is a Part B. They call it a give back or a buyback plan. That's the plans that give you money back into your Part B, which reduces that $170 a month. Those are for healthy folks who typically see a doctor 1, 2, 3 times a year, right? Which is similar to your situation. And then the next is a PPO, Preferred Provider Organization. That one, you don't have to get referrals, but every time you go to the doctor, you're going to come out of pocket. It doesn't really make much sense for you because you don't have specialists. You're not seeing, a bunch of doctors. So based on what I see here, we have a few different plans that offer a zero primary copay, a zero specialist copay. One of the top plans that we offer sells their plan. They have a $500 maximum out-of-pocket limit, which means if you go to the, let's say the ER, for example, it's a $120 copay. If you go to the ER 4 times in a year and you're not admitted, you should go to urgent care, 1. But 2, you're going to be at $480 out of pocket. Once you hit that $500 number, everything that happens to you the rest of the year is going to be free. God forbid you're hospitalized for 2 months, all those copays go down to 0. You're not going to pay anything. How's that sound?
Sounds good. I do have a question. What's the difference between a maximum out of pocket and a deductible?
So the deductible is like your car insurance, right? So let's use your car, for example. You have a car insurance, your deductible is $5,000. Someone smashes into the back of you, you're out $5,000. Then the insurance company is going to pick up the rest, right? It's $12,000 worth of damage. You have a $5,000 deductible. you're going to pay $5,000. The insurance company is going to pay $7,000.
Okay.
That's a deductible, right? A maximum out of pocket is, let's say your car insurance said, hey, we got the best. This doesn't exist, by the way, especially in Miami. I wish it did, right? But they're going to say the most you can come out of pocket for any accident is $500, and then we're going to take the rest. So it's like kind of like a deductible, but it's the maximum you'll pay for that calendar year.
So it'd be like if someone hit me and I would only have to come out of pocket for the bumper, $500, and then everything else they cover.
Right. So you're going to pay $500. The insurance company is now in the same scenario is going to pay $11,500.
Okay. Awesome.
Other questions you have about Medicare, Medicare Advantage?
What are the next steps?
The next steps, I have your Medicare card right here. I have your ID card right here. So what I'm going to do now is I'm going to put your information into a proprietary software. I'm going to put in your medications. I'm going to put in all of your information, the zip code we live in here, because the plans are by zip code. It's going to pull up the different plans. It's going to show us the out-of-pocket maximum. It's going to show you how much you're going to pay for your prescription drugs. And then we're going to choose, I'm going to show you the top 3 plans available to you. We're going to choose a plan, the plan that best fits your needs. Then we're going to see if that plan takes your doctor. If that plan doesn't take your doctor, I'll find you one that's going to be able to fit your needs. It's going to be close to the house.
Awesome.
Perfect. So we're going to do that here right now. And then we're going to go to the Care Compare video. Obviously, that training is awesome. The Care Compare training, you want to make sure you do that training. After we do the Care Compare training, we're going to enroll the client directly into Care Compare. I'm going to get the confirmation number. I'm going to complete the health risk assessment. All the companies pay an additional commission for the health risk assessment. And then I'm going to come back to Tristan. I'm going to say, Tristan, that was pretty simple, right?
Yeah, that was super fast.
Didn't you think it was going to be hard and confusing and I was going to be in your house for 3 hours?
Yeah.
Yeah, I'm not. Don't worry. No, we do have those people, though. They wear gold watches and they wear a suit in 110 degrees. I'm not that guy, as you can see.
Yeah.
So I brought some value to you today. What'd you learn today? Kind of tell me a little bit about what we did today and how it benefited you sitting down with me.
Well, I learned how easy it is.
Right.
You know, it doesn't need to be that complicated. Everybody makes it seem so complicated. I got like 70 pounds of mail.
Right. You can throw all that away now. Recycle it if you like. Get rid of the phone books.
Mm-hmm. Yeah, it's just really easy, and I learned a lot about Medicare. Awesome. I didn't know about maximum out of pocket. I didn't know, how the deductibles would work. I thought I'd be paying a lot more for it.
Right.
So,
right. And that's the benefit of sitting down with me, right? Because I'm licensed by the Florida Department of Financial Services. For each one of these plans, from Aetna to WellCare, I have to get recertified every single year to continue to educate people and to enroll them into the plan. Right. So now it sounds simple to you, but this is your situation. So if you just go tell your friend, hey, Bill, enroll in WellCare, enroll in Aetna, enroll in Humana Care Plus, Bill could take 12 medications with 14 specialists, and he's not going to be your friend for very long.
Makes sense.
Right. So we need to put all your information into this system. That's why it's so important to sit down with someone who can explain it to you. Right. A good teacher can explain something difficult. Right. A good insurance broker can explain something that could be difficult or confusing. Right. You enroll in the wrong plan, you're stuck for the entire year. So it's hugely important you sit down with me, and I appreciate that. You're a teacher for many, many years. Any close teachers you have that you have relationships with, that you had lunch with, their kids that are around your age?
Yeah. I could probably think of a few. I could probably shoot him a call.
Who comes to mind first?
Jerry.
Jerry. Who's Jerry? He's a coworker. Same. What classes? What does he teach?
Biology.
Biology. Oh, biologists are smart. He has kids. The family.
Yeah, a little bit. Yeah.
Okay. Awesome. And he's retiring around. He's older or younger than you? Do you know?
He's actually going to be retiring with me.
Oh, okay. So you guys have been in the system many, many years.
Awesome. Yeah, but I think he's a little bit older. I don't think he's turning 65. I think he's 66, 67.
Okay. So he waited a little bit longer for his Social Security. No worries there. You have your phone right here. If you wouldn't mind giving Jerry a call, just letting him know you sat down with me. And then you can put me on the phone with him. I can introduce myself and see I can set up a time to go do the same kind of presentation I did hear from him. When you call him, rest assured, I'm going to treat him with the same respect I treated you. I'm not going to get his phone number from you and call him 14 times a day for 3 weeks. So he blocks me and blocks you. I'm going to sit down, present the same information. If I can help him, awesome. If not, at least you did the due diligence to help out Jerry. Make sense?
That makes sense.
Awesome. Grab your phone and give him a ring.
Okay.
Perfect. Thanks for Jerry's phone number. As you heard, I'm going to sit down with him next week. So that's awesome. I appreciate that. I do a lot of work to find nice folks like you, and it's makes my job easier. You can help me out with anybody else that you know. So after Jerry, who comes next? You said two or three, four people came to mind.
Yeah, Mary.
Mary, Jerry, and Mary. They married?
No.
Oh, that'd be cool if they were. All right, so we're gonna go through the same process here with Tristan. And we're gonna get as many referrals as we can because these are free leads, these are free appointments. Tristan's calling Jerry, he's calling Mary, he's saying, "Hey, talk to my guy. My guy knows what he's doing." If someone tells you, "Hey, go to this restaurant, go check out this movie," right? Go see Top Gun, right? It's the best movie I've ever seen in my life. You're gonna go see Top Gun because you trust Tristan, you've known him for many years. These folks are gonna treat you with the same respect that they treat Tristan with. You're going to go into that appointment, and unless you really royally screw it up, you're going to have another sale. So that's as easy it is as a Medicare Advantage presentation.